Good morning. First of all, I have got to thank my viewer Linda, who basically produced all the shows for this week. She has given me some information through the articles that she shared with me that at first I was like, oh my gosh, it's so much information to read. But boy, once I started reading, it's like that big, thick book you don't want to start. And then once you start it, you can't put it down. So thank you, Linda, as well as all the other friends of this show who give me awesome story ideas every week. The singing chaplain, Chris, and Angie, and Linda, you have been invaluable to me this week, and I thank you very, very much. I really do. If you see a little dog at the window back there, that is because her daddy is at the dentist and she misses him and she's waiting for him to come home, which he may do during this show. Again, it's a live show. One never knows. So today we're going to talk about, again, there was a theme to this week's shows, and this one kind of connects all the dots, and I love it when that happens. We're talking about HIPAA today. Now, not HIPPO, HIPAA. And many of you may think you know what HIPAA means. Oh, it's a law that protects you and your privacy with your medical records, right? Not so quick. First of all, HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. Now, you notice in that wording, there's nothing that says actual privacy, okay? And yet, when HIPAA first came out, and I would go to the doctor, and after I got married, it was so bizarre because my husband and I had to sign all kinds of extra forms in order for doctors to share information with either of us about the other one. So basically, I had to sign special paperwork to allow a doctor to speak to my husband, or my husband to call a doctor, or the doctor can't even leave a message on my answering machine giving me a test result because somebody other than myself might hear it. And that was all. They said that was because of HIPAA. I had to sign papers to allow my husband to pick up a prescription for me at the pharmacy because of HIPAA. So it's illegal for them to share information with my husband or vice versa if we don't sign special papers. But guess who it is legal for them to share information with? Oh, like over 600,000 other entities, actually 2.2 million entities. And this is because of something called the High-Tech Act, which happened after HIPAA. And most of our medical records right now are electronically filed up in the cloud somewhere. And any hacker, of course, can get them. But here's who else can get them without your consent. Health insurance companies, of course. Who has more at stake to know your medical records? Even though now after Obamacare, they're not allowed to ask you personally to fill out the paperwork about your medical history and have you ever done this or have you ever done this or how much do you drink? They're not allowed to ask that anymore, but they can still find out. And this isn't exactly rocket science either, because health insurance companies they have doctors on staff. They have people on staff who basically can interpret claim forms. Like if I file a claim that, I send a claim in that I had a biopsy, they can connect the dots and assume that I may be getting tested for cancer. If I start submitting claims for insulin or diabetic testing supplies, they can assume that I'm diabetic. But this is a little bit different because there are a lot of other people who are allowed to have your information without your consent. And this is something I found today on Wikipedia. They can disclose protected health information to facilitate payment, treatment, or health operations without your consent. I don't even know what that means. If anybody here is listening to me and knows what that means, please tell me, because I don't know what that means. But I do know that when you go to the doctor's office and they ask you to sign the HIPAA form, this isn't there. It's not on the form. It doesn't say that, even in small print. Believe me, I've read them. It doesn't say it. Okay? Okay, now, there's something that we need to talk about called coerced consent. Now, we talked about consent a lot this week, informed consent. But this is coerced consent. And on the articles that Linda sent me, there were personal stories of patients who refused to sign the HIPAA form and were told that if they didn't sign it, they weren't going to get treatment. And these were some people who were in an emergency situation where they needed treatment now. And they said, well, I don't want to sign that. Well, then we're not going to treat you. Or if we do treat you, even if you have health insurance, you're going to need to pay cash. We can't put this through your health insurance if you don't sign the HIPAA form. Now, why? And I'll tell you why. Because if you don't sign the HIPAA form and they send it through your insurance, the insurance won't be able to know why you were at the doctor. That's my theory. I don't know if that's true, but it sounds right to me. Why else would they say, well, you don't have to sign the HIPAA form, but then you must pay cash. We can't put this through your insurance. It sounds to me like if we don't sign the HIPAA consent, then the medical practice or the ER or the hospital cannot share why we were there with the health insurance, and therefore they're going to have issues because the health insurance wants to know. They want to know if we have become a high-risk client because we dared to file a claim. But now here's the real law, and this is where informed consent comes in. Information. I tell you every day at the end of every show to stay informed. And usually it's about what's going on in the world and current events and politics, but this is about you. This is about your life. This is about your health, and it's about your privacy. This is where you really need to be informed. You do not have to sign the HIPAA form, and you can look it up. In fact, I encourage all of you right now to bookmark it on your phone, on your cell phone. There is a website and you can Google it. Do I have to sign the HIPAA form? No, you do not. Now, here's what they're going to try to tell you when you say you don't want to sign it. Well, we can't treat you. You must sign it. You have to sign it. It's for your protection. And you know what you say then? I need to talk to somebody else. Get me someone who is higher. I want to talk to your boss. And by the way, here it is on my phone. I don't have to sign it. And that is the law. But there's a way they get around that too. Because everybody must sign a consent form for treatment when they go for a medical visit or a dentist visit or a hospital visit. You sign a consent form. And some of these hospitals and medical practices have started adding the HIPAA along with the, yes, I have insurance, yes, I promise to pay, and yes, I consent to treatment. And it's all on one page. And the HIPAA is down there. And some people don't know it. And they sign, which also activates the HIPAA, which activates the HITECH Act, which activates that your records will be on an electronic cloud somewhere on the internet, and anybody can find it. And the people who are finding it, the people who are getting access to your personal medical files that only you, your doctor, and your spouse or a parent or whoever you share it with should have, are government entities, are the National Institutes of Health, the CDC, pharmaceutical companies, insurance companies. These are people, third parties, strangers you never met, where they won't share your medical information with your husband or wife if you don't sign a special paper, but they will share your information with all these other people that have never met you. So you need to be aware. Look for that when you're signing a consent form. And also, there are some very good family practices and hospitals that actually have a little box. It might be in that really small print we talk about. Put your bifocals on, get your magnifying glass, and it has a box that says, I do not want to sign HIPAA. And you check that box. Look for it. It's important. And we have been connecting dots this week, and this week has had a theme. And it started on Monday's show with opioids and Dr. Death. And I heard something last night. Americans, of all the opioids Vicodin, Percocet, Demerol, hydrocodone is the big one. Of all the prescriptions in the whole world, 99% of prescriptions written for these drugs are written in the United States of America. 99%. We are the most over-medicated country, over-prescribed using prescription drugs country in the world. Something to think about. And I saw a commercial today, which is very interesting, was very interesting to me. And I didn't connect it, but again, it connects the dots because of these farm companies who are benefiting. And they get you coming and going and coming and going is kind of accurate since there is a condition if you take painkillers, the prescription painkillers. $650 billion a year business, by the way, painkillers. It's called opioid-induced constipation. Now, we all know what constipation is. But there's a drug for that. There's a pharmaceutical drug that if you are taking their script poisons, their Vicodin, their Percocet, the hydrocodone, the oxycodone, and you get stopped up, they have another drug that you can pay them for that will take care of that for you and help you enjoy the go again. I mean, really? Yeah, please don't stop using our hydrocodone. Please don't stop using our drugs. We have a drug to offset the side effects. It's kind of like when you do the chemo and it's $4,000 a month, and the drug that offsets the nausea and the nasty side effects from chemo is $1,500 a month. You know, yeah, this is expensive, but we have another drug for that. And oh my gosh, it's only $1,500 a month. It's cheaper. And it'll make you feel so much better while you're using our poison. Interesting, isn't it? Okay, Linda, you're going to love this. I have political Paula has the right, as every woman does, to change her mind. And I have now changed my mind a little bit on vaccines. And this is why. I have two viewer stories. And again, I am respecting their privacy. I am not going to mention names or tell you that much about them personally. But these are personal stories. So the interesting story that I teased about in the promo for this show is that a viewer shared her child's vaccination certificate with me yesterday. And compared to my vaccination certificate, I was born in 1964. My certificate is a card maybe about this big. This is what my vaccination certificate looks like. You open it up and there's maybe like 4 things on there. Her child's vaccination certificate took up 3 different messages. It was pages and pages and pages long. There are probably about 25 different things that her child was vaccinated for, and her child is approximately 10 years old. I'm not going to give the real age, but let's just say within the last 10 years, these vaccinations. And when I read what this child was vaccinated for, I was like, what the hell is that? First of all, I can't pronounce half of them. And the fact that my husband and I were not vaccinated against them, and we are healthy as a horse. My cousins my age and I were not vaccinated for these things. And then the reaction of this parent when I said about, well, you're going to get the Gardasil vaccine, right? The HPV, the cervical cancer vaccine, which is for boys and girls. And, well, I don't know if I'm going to do that because I don't know it. There's side effects. And, you know, I don't have it. I don't have HPV. Well, guess what? When I looked at all the illnesses that this child has been vaccinated for already, like 20-something of them, and I looked at them and I thought, well, I've never been vaccinated for them. I've never been exposed to them. And the likelihood of this child being exposed to them is very rare. But one thing that every man and woman, every boy and girl in this country will be exposed to is the human papillomavirus. It is a strictly sexually transmitted disease. And by the way, it's not a gay disease. It is not prevalent in the gay community. It is a heterosexual sexually transmitted disease. And by the way, men who have HPV have almost no symptoms. They rarely get symptoms. It is the women who suffer as usual. We are the ones that get the bad pap smears. We are the ones that have to go through the treatment for it, which includes cryosurgeries, biopsies, and possibly removing our cervix and becoming sterile, unable to have the babies. Remember, we talk about you want to keep women fertile having their babies. Well, the way to make sure of that is to eradicate cervical cancer because it affects mostly young women. And I'm not talking about promiscuous women here. I'm talking about virgins on their wedding night who get HPV because their husbands have it and don't know it. Okay? So it is 100% that any woman or man in this country who is having sex without the use of a condom and who uses condoms with their husbands, that they are exposed and at risk for HPV, the human papillomavirus. So this is a vaccine that people should have, that young people should have. I wish I could get it even now because back in 2006, you remember my story, I had a bad pap smear at 41 years old. I had been with my husband for, 12, 15 years. And I was told I had HPV even though I was never tested for it. And that was odd. And then they said, well, please don't blame your husband. Well, I resented my husband for 6 months because I had to wait 6 months and I had another pap smear and I had an HPV test and they were both negative. So I knew my husband did not give me cancer. And that was really a good thing to know because I was pissed. This is the most preventable cancer in our world, cervical cancer. It is 100% preventable with this vaccine. And yes, there's side effects. Like everything, there is a risk. But when you look at what these infants, these babies are being vaccinated for, pneumococcal pneumonia, meningitis. I never had meningitis, and I certainly wasn't vaccinated for it. And I wasn't vaccinated for chickenpox either, but I was exposed to them as a child, and I never got them. I'm immune. I am naturally immune to chickenpox, believe it or not. Just lucky, I guess. But we are vaccinating for these things, and the parents are like, yep, go ahead, do it, but not so sure about the cancer vaccine. So look, I do believe that our children are being over-vaccinated when I looked at this vaccination certificate, and I saw all these things I can't pronounce, things I've never heard of anybody getting. At least not in my world, in my circle. And then I hear a parent saying, well, I'm not sure about the Gardasil vaccine, the cervical cancer vaccine. And I'm sorry, I respectfully disagree with that. Because I think any vaccine that can stop any woman or any man from being... My husband felt like shit for 6 months because there's no test for the man. My husband could not go get tested to see if he had HPV. Because if he could have, he would have done that immediately. And we would have known he doesn't have it, which means I can't have it. But there's no test. So there is no way for a woman to know, even on her wedding night, if her husband has HPV. But if she's been vaccinated for it, and if he, as a young man at 9, 10 years old, was vaccinated for it, they can rest assured they probably won't get it. And won't have to suffer through the agony that I've suffered and what millions of women go through who have HPV, wondering if today's the day it's going to crop up again. Because it's chronic. It's not curable. They can't cure it. The only true cure is removing your cervix. Because the pap smears sometimes are good, sometimes they're bad. And when they're bad, you always have to get some form of treatment. Now, we already know doctors are loath to remove any reproductive organs in a healthy woman. So what they end up doing is Band-Aid procedures, cryosurgeries, and biopsies, and 4 or 5 pap smears a year till you get clear. And it's stressful, and it's expensive. Because guess what? Once again, insurance covers the diagnosis, but they don't cover the treatment. So the first pap smear is on the insurance company. The rest of them is on you till you meet your deductible. And yesterday was all about my mom. And I'm thinking about my mom a lot this week. And in fact, next Wednesday is April the 12th. the anniversary of my mother's death. So next Wednesday, there will be a special tribute and a show about my mom. Don't miss it. It's going to be very, very cool if I can get through it. Even 14 years later, it's very raw. And a viewer, a very good friend of this show, shared a very personal story with me. And again, I'm not going to divulge their identity because it's a personal matter, but I will tell you the story because it's important. And this person's mother passed away in the 80s, 1985, I believe, from AIDS. And she got AIDS through a blood transfusion. And back, remember, we talked about this, about AIDS, and how back when it first was discovered, it was a gay disease. And nobody cared. Nobody cared. And I strongly urge all of you to watch one of my favorite films called And the Band Played On, because that will tell you what happened. And the person who shared this story said that they feel guilty because they wish they had said, well, we'll give blood for mom. But I reminded this person yesterday that in 1985, we knew it was a blood-related disease. And the CDC doctors and the doctors trying to find cures and find out how to stop this epidemic of AIDS, they urged the blood banks and the Red Cross to test the blood using the hepatitis B test. Because the hepatitis test actually was very accurate. People with AIDS who tested positive, the hepatitis B test diagnosed that. And when the doctors went to the blood banks and the Red Cross, they all said, it's too expensive. We can't afford to test every pint of blood we take from a donor. And a lot of people got AIDS through blood transfusions. Arthur Ashe got it, the tennis player. He had heart surgery. There were some very wealthy people who got AIDS. And that story is told in And the Band Played On. And that is how the testing started, because this wealthy woman had heart surgery. And she basically says in the movie, you mean they're purposely giving AIDS to people? They knew it because they refused to test. And after that, they started testing. So I told this person who feels so guilty that don't feel guilty. I feel guilty over things that I didn't do when my mother was killed by a medical disaster, a perfect storm of mistakes that were made. But I was young, and this person was even younger when their mother died. And we didn't know. I didn't know when my mom, I should have known, but I didn't know that I could have just refused that surgery since the doctor didn't show up, the doctor who knew her and knew her condition. I didn't know that. Plus, I didn't have the balls at that age. Even at 39, I didn't have the balls to question a doctor. Mom never would have. So don't feel guilty, my friend. I hope you're watching the show today. Do not feel guilty. Because what actually killed your mother was money, as always. The fact that hemophiliacs, Ryan White, the beautiful young man who was killed because they refused to test the blood supply, and he needed the blood supply, the plasma, because he was a hemophiliac. Many hemophiliacs died. And one doctor, Matthew Modine plays the lead character, the lead doctor, who really, Dr. Francis is his name, Don Francis. And he still works, at least at the end of that film, they said he is still working on a cure for AIDS to this day. And at the hearing, they said, well, we can't test because a couple of dead hemophiliacs. And he looked at them, he said, how many dead hemophiliacs do you need? He said, please give us a number so we won't keep bothering you with our requests. And when are you going to realize that it is cheaper to save people than to settle lawsuits? So, my dear friend, if you are watching, it's not your fault your mom died. It is bureaucracy's fault. It is the fact that AIDS was killing people nobody cared about. And when people they cared about started dying, it was about money. We can't compete. If they're going to test the blood, then we have to test the blood. And now that's going to be who's going to pay for this? And then rich people started dying from bad blood transfusions. And then things got done, as usual. All it takes is for a famous tennis player and a couple wealthy socialites dying from a blood transfusion. Things get done. Isn't it sad? It's very sad. So we've had a really good week. Tomorrow's show is going to be kind of an update. It's kind of a not fun Friday, but it's going to be just some stuff that's bugging me and stuff that happened. I am going to talk about Netflix and cable companies, and I'm also going to give an update on something that Donald Trump did yesterday that actually impressed me. So I hope you stay tuned for tomorrow's show. And look, stay informed. Please stay informed. Know that you can say no. You can say no to a prescription. You can say no to a surgery. My mother would be alive today if she had just had the hysterectomy on April the 8th, 2004. She would be here today. Barring any unforeseen other things, she would be in her 80s now. She would be 81 years old, but it's something that bothers you. And so stay informed, understand your rights. You don't have to sign a HIPAA form. You do not have to consent to a surgery if you're not sure the right doctor's going to show up. And you certainly need to be vigilant and know what your rights are. And remember that just because the government says it's good for you, it's not always good for you. And just because a doctor says it's good for you, like Monday's show, Dr. Feelgood, doesn't mean it's good for you. It might be good for your neighbor. They might have taken it and done well, but it might not be good for you. I had mentioned in a comment that sometimes on a weekend when I get my drink on and I smoke a lot of cigarettes, like 2-3 packs on a weekend because I'm partying, I feel like shit. But I have never felt as much like shit as the day I took that one Vicodin. I have never felt like that in my life, and I hope I never feel like that again. Give me a hangover after drinking hardcore moonshine whiskey any day of the week than the effects that Vicodin had on me. I really thought that Political Paula was on her way to the ER that day. Won't ever do it again. So please stay informed, know your rights, and I'll see you all back here tomorrow. And thank you again to Linda for your fabulous, informative, and thank you to the viewers who share their personal stories with me. They mean a lot. It's nice to know that I'm not alone out here with my thoughts and my feelings and my guilt. But I don't feel guilty anymore. You know, I did everything I could, and we all do everything we can. And the more informed we are, the better. If I knew then what I know now, we all say it. But we didn't, and now we do. So going forward, we can make informed decisions, informed consent, and we can say no. And love shows and grows, and I love you all very much. And I am so grateful for your friendship, for your honesty, for sharing your stories with me. I'll see you tomorrow. Political Paula, out.